All right. Welcome back, students, for a value-added course on applications of blood stem cells in healthcare. And today's lecture topic is pre-HCT evaluation of recipients, delivered by Dr. Anuradha ma'am, who is the Senior Associate in Dathri Blood Stem Cell Donor Registry. So this VAC course is a series of lectures conducted by the Department of Medical Lab Technology, Chandigarh University. So the main purpose of this lectures is to enhance a value to your ongoing program, that is medical lab technology. So I hope that this series of lectures will enlighten your better understanding of your field and understanding the latest trends and the new areas such as stem cells and how these stem cells can save patient lives, especially the patients who are under this cancer and terminal illness conditions. So I would really appreciate the time that is dedicated by Anuradha ma'am, who is spending for us. Ma'am is very busy actually. And thank you so much, ma'am, for accepting our invitation and sparing your time with us. It is very valuable for us to join with you and to learn your personal experiences and your emotional journey in this field and your, you know, helping to the society. We really appreciate you, ma'am, and over to you, ma'am.
Thank you so much. In fact, I am sorry that last week I could not join the session.
No issue.
Because I had two back-to-back collections and two donors were donating, and I had to coordinate with the donors and the people who are engaged in the donation and all those things. So, we are basically right now talking about the patients and their pre-transplant conditions and their psychological tests and all. Donors also go through the same. I mean, they are also worried because they don't know much about the GCSF injections and all those things if they are not from the medical field or sciences field. So and also we are also dealing with the humans. So when the donation when the GCSF process starts, we also undergo the equal amount of stress that the donor is also going that through. So it all becomes very difficult to handle. But yes, now we successfully completed those two donations and the donors are well, so we are relieved. I mean, of course the donors are always well, but sometimes after the donation also some donors may have lower back pain and due to the GCSF, side effects of GCSF, which settles down in a day or two, but until it completely gets over, donors are worried because they are not aware of the situation. We are dealing with all such cases on day-to-day basis, but of course we have to be continuously in touch with the donor and keep specifying them, no, please wait. And of course if it does not go, then we have to seek advice from the doctors and we prescribe the medication and take care of the donors. So yes, anyways, so I'll continue with the presentation.
Oh, 1 second, ma'am. I will give rights. I almost forgot. Yeah,
Yes.
now you will get rights, ma'am. You can share.
Okay. That's good. Are you able to see the slides?
Yes, ma'am. We can see case studies.
Okay. So we will do, I will be talking about two cases here. One case orally and one case of my own. So let us begin with the patient profile first. The patient name is Sarah. She is diagnosed with acute myeloid leukemia. And the medical history is Sarah has a history of recurrent bacterial infection. So Sarah is being evaluated for HCT. For AML, it is compulsory. Almost all types of AML. AML has M1 to M7 categories, and M1, they can be of M1 to M7 types, and low, medium, and high risk categories. And usually for medium and high risk categories, HCT is must. And again, also depending on the type of the AML, the decision for HCT is being taken. But irrespective of the type of the disease, if the patient is in medium or high risk category, HCT is advised. So, as I said, she's being evaluated for hematopoietic cell transplantation. She's concerned about her recurring infections and wants to understand the risks involved in the transplantation process. So, according to you, I would like to ask the students, since we already talked about the various tests and all, what all laboratory tests should she undergo, and how would you address her concern about the recurrent infections during the transplant? Any answers? What all laboratory tests are required?
From the previous lectures, you said that assessment tests such as CBC can be conducted, and also to check the bone marrow's biopsy or any history of medical history of previous infections. Also, about her concern about the infections, they provide the medical or the immunosuppressants, so she should not be worried.
Correct. So, as Faith said, the CBC needs to be done to assess her hematological health, blood chemistry panel to evaluate her organ function, and comprehensive infectious disease screening must be done to address her bacterial infection worries, because then only we'll get to know what are all underlying infections that she has. Following to this test, during the counseling process before the transplant, it is like, the physician explains or talks about the infections post transplant and their plan to tackle this infections, or we in medical terminology we say that infections prophylaxis measures will be discussed with Sarah, and how this will help her and how this prophylaxis measure will help the minimize the risk of the infections post transplant. And Sarah needs to be given the correct information at each and every step of the transplant process
One
to
more answer
ensure
in chat box, ma'am.
Okay, one more answer is there, right? I would make her aware that the infections will be treated correct. I agree. Treated before transplant and after transplant may not have the same recurrent infections. Perfect. So, and also she needs to be supported emotionally, and she has to be kept well informed. So this is the case 1. Case 2 is the patient Emily. She aged 12 years and she's diagnosed with severe aplastic anemia. None medical history, none. She doesn't have any other issues or medical conditions. She's very young, so we assume that she does not have it has been evaluated, or no medical history is reported by her family. So now her parents are mainly concerned about the complications post transplant, and which is a major issue. Again, the laboratory test. What all laboratory test would you recommend to Emily? And how would you address the parental concern and provide the psychological support during the evaluation process? Anyone? I think, sir, you are on mute. Vamsi, sir.
Yes, ma'am. Ma'am, I guess, ma'am, what I concerned is, since she is aplastic anemic, gradually her bone cells are depleting, bone marrow depleting. I suspect she might have a bleeding disorders, ma'am. I will go with bleeding time along with CBC and organ function test, but I must ensure whether she can her platelet levels And I'm not sure how the doctors are evaluating the platelet levels, ma'am, because there is a chance of excessive bleeding during the transfusion. I don't know, ma'am. How is there any answer, ma'am, for it?
See, like if she at the time of transplant, during the preconditioning state, all her cells will be killed, including her platelets.
Yes.
So once the cells engraftment takes place, of course, her platelets needs to be monitored to prevent her bleeding disorder issues and all. So definitely that is must. Again, Emily is healthy, so her positive consequences after transplant will be only minor. But if she has 100% match, she's safe. However, there are always exceptions. So, Mavizi, good answer. But again, for aplastic anemia, doctors prefer full match. They hardly ever go with 9/10 match. I haven't seen in my journey with Dathri, I haven't seen any aplastic anemia patient being transplanted with 9/10 match even. So yes, Emily is generally in good health condition. So all the laboratory tests will be performed so that if there is any underlying issues which is not addressed, that can be taken care. So CBC again for hematological health, blood chemistry panel for her organ function, HLA typing is must, X-ray for her pulmonary function, and the psychological evaluations for her emotional well-being, because she is a teenager, and as all of you are aware, teenage is very vulnerable age or vulnerable time of in anyone's life. So definitely her emotional well-being is also required to be addressed, and addressing the parental concerns involve open and empathetic communication, providing detailed information, and the potential risks and the benefit. So as someone has written in the chat box that since she does not have any underlying condition, the risk of having post-transplant infections are very less if her environment is well maintained. So, and the benefit is she will come out of it definitely, because her age is on her side. No other medical conditions are there. So, in children below 12 years of age, these days we are seeing the transplant success rate is near about 100%. It is like somewhere between 95 to 98%. Very rare case we have seen the unsuccessful transplant, I would put it. So recently there was a case of a 7-year-old girl diagnosed with thalassemia, and her donor was 32-year-old female, young female. The donation happened and the child underwent the transplant. Things were going well. After the transplant, she started complaining about stomachache, and she could not eat even a single chapati, so single roti or single bread. So doctors started evaluating. They carried out number of tests. They could not find out, and ultimately, when they could understand the issue, it was the GVHD in liver, and it was grade 4 GVHD by then. I mean, when the doctors could diagnose. And unfortunately, though the child was young, she had no other medical conditions. Her ferritin level and everything was completely fine. She could not be survived. Donor side was also perfect. Donor side was also no issues. But again, so of course risks are involved, but still, as I said, success rate is somewhere around 98%. So definitely going for, if no transplant will be done, then there is almost no chance of survival. Even if that like I should not say like that, but no transplant would have been done, that probably that girl would have been living with so many physical issues and all. But this was really unfortunate. On the other side, we have come across the cases where grade 4 GVHD was diagnosed and patient could come out of it. And one of the issues that I could understand with that girl was her mother was very weak. She was emotionally very weak. Her father could not go inside the BMT because he was running around and he was having some viral infection and all, so he was not allowed inside the BMT unit. Her mother was emotionally not so good. She was like, she would also start crying once her daughter would start complaining and all. So emotional well-being of the parents is also equally important in case of transplants. So that was really unfortunate case. So in Emily's case also, parents have to be well informed about the potential risks and the benefits. In case of aplastic anemias, of course, as I said, the survival due to the age of Emily, the survival chances are almost 100%. And for to support psychologically during the transplant, a social worker or a psychologist has to be assigned. And in outside India, these cases are like, the social workers or psychologists are usually assigned to each and every patient. But I'm not sure about India. But on demand, yes, we used to have psychologists who would come and help us, or like I can always go to a psychologist and can talk about my stress points and all those things, because uh, during I would talk about our case later on. So this was case study 2. Case study 3 I wanted to include in PPT, but I did not have time. This was a case of parent. They were, since childhood they were studying together, and as they grew up they decided to spend their rest of the life with each other, and both of us were aware that they are thalassemia minors or thalassemia carriers. So after consultation with the doctor, they decided to get married. They got married. The lady conceived, and they went to the doctor during 3rd month of pregnancy. Number of tests are done for the child. They also got the thalassemia test done, and they got to know that the mother is having twins. And doctor said that no, both the children are normal. None of them are having thalassemia major. They were happy. The pregnancy got over and the lady gave birth to 2 children. Things were normal, but suddenly, like after 2 months of birth, one child was very weak, the other child was active. The one child would have infections frequently, and then they had a doubt. They underwent, they met the pediatrician, and they got to know that one of the child, both were boys. So one of the boy had thalassemia major. So number one, when you get the thalassemia major test done at the time of pregnancy, it is not 100% sure. So and this was the case of Chennai. So now parents were again, like, they were devastated, and doctor suggested HCT for that child. Luckily, the twin brother was a 100% match with that child, and the donation happened through Dathri, and now both the children are doing well. So again, this family was like, this family was very close to the co-founder of Dathri, so they had like good mental support and moral support and all. So, and now the child is doing well. And case study 3, or should I say our case, my husband's name is Gaurav. His journey from AB negative to O positive. So in the first picture, as you can see in 2000, this picture was taken in 2007, and we were on a family vacation. 2008 September or August, he organized a blood donation camp in his office. He also donated blood. And in the month of September, he started having fever. And it would come and go, would come and go. And again, in the first week of November, he had continuous fever. And he then went to the family doctor and said that, like, I have fever. And doctor said that this could be the viral infection. Medications were given. And after 3-4 days, even the fever did not go. So the doctor suggested that let us change the medicine. But before that, please get your blood test done. Said fine. He went to a laboratory, and once the test report came, the laboratory guy called him and said, I want to talk to your doctor. And he was saying, why you want to talk to the doctor? Ultimately, it came out that his WBC were 2 lakh. Normally, which is 4,000 to 11,000. His WBCs were 2 lakh. So doctor suggested that you better went to another hospital, Hinduja Hospital in Mumbai. We were in Mumbai at that point of time. So Hinduja Hospital, go to Hinduja Hospital, meet this doctor, and she'll help you out. And there it was confirmed my husband had AML. Bone marrow biopsy was done. There we got to know that he has AML M2 type and a high risk category. So day one itself, doctor had told us that you start finding the donor, because in your case, BMT or HCT is the only cure for yourself. So first of all, we got my husband's HLA typing done. Following to that, immediately we called her sisters and his brother. We got HLA typing done for them. No match. So we were like, what to do next? So we had two options. One was to find the unrelated donor, and the other was to go for haploidentical transplant. In haploidentical transplant, one of the patient's family member has a half match with the patient, half match HLA with the patient. So Gaurav's elder sister was a half match. So we started then evaluating the outcomes. So what all like doctors should have been doing, we were doing it at that point of time. And in India at that point of time, only one unrelated donor transplant had happened. No other transplant, and only one hospital was doing. So this is the picture of my husband during the first chemotherapy. One day I had been to the hospital, and I was staying with my husband. My son was staying with the family, and I used to go, to meet our son after 3-4 days for 2 hours or so. Meeting my son, leaving my son was also an issue, but I did not want to. I wanted to be with my husband at the same time. So we were managing things like that. And one day when I went to the hospital, my husband put his hand on head, and I knew my hair are coming out, like was the side effect of chemotherapy. And ultimately he became bald all over. So this was all the problems that we were facing. This was all the emotional issues, and that was not a big problem. Becoming a bald was not a problem. The problem was like, what will happen next? Will he be able to come out of this? How shall we go for transplant? And again, the transplant cost is huge. And when my husband underwent the blood stem cell transplant, doctors were giving the budget of rupees 1 crore for going for a transplant. And being from a middle class family, it is always difficult. So for a patient family who is going for transplant, they have all the issues, they have to take care of the patient, they have to take care of the finances, they have to take care of the children if patient has the children. All those issues need to be taken care. So we were thinking of money, we were thinking of finding a donor, we were thinking of options. So then my students, I was working as a faculty in one of the institutes in Mumbai. So my students got to know that my husband is suffering from the disease and they are in need of money. So I'm very lucky and I'm very proud of my students. They came forward and they raised some funds for my husband. We sold off our home, our car. My husband was fond of bike. At that point of time, he had Royal Enfield. We sold off that also. And even after that, like we were sort of, we did not had enough money. So my students came in and they also raised funds for my husband. And so we had enough money for the transplant. The issue was the donor. There was one after my first time when my husband's cancer was diagnosed, he came out of it. He got cured of cancer, and for transplant, that stage we call the patient is in remission. So, and for a patient to undergo transplant, remission is almost compulsory. Like otherwise, doctors do not prefer to, go for transplant. In very rare case where the patient is not able to be into remission, that is free of cancer, even with the high dose of chemotherapy, then sometimes they decide to go for transplant with the deceased cell in the patient's body. So when my husband was in first remission, that is free of disease, we had one donor from USA. And the donor's age was 58 years old. So age was not by his side, but he was the only donor. So we said, okay. But then we got to know that the donor is diabetic and he cannot donate. So again, we were at the same situation. So we were evaluating the option of haploidentical transplant, which was in the clinical trial stages at that point of time. So, but then we had no option. I mean, for survival, we had to decide. So we were thinking of it, but by then the disease came back. My husband had a relapse, and then the Hinduja hospital doctor raised her hand. She said, I'm not able to handle this case now. You either go outside of India or you rush to CMC Vellore. Doctors over there only will be able to handle the case. So my husband wanted to go outside India. We had, of course, money. So by then, but unfortunately, the day he was diagnosed with the relapse was Friday evening. Saturday, Sunday embassies would be closed. We would get no visas. So we had no choice but to rush to Vellore. We went there. His salvage chemotherapy started. And due to the high dose of salvage chemotherapy, my husband had so much of side effects and he was so much in pain that during the chemotherapy, he was on morphine 24/7. And he had no, he was not in his senses. After 7 days, the chemotherapy got over, morphine was taken off, and doctors thought that slowly he will recover. But his counts did not increase at its own until 22 days. He had severe ulcers in his mouth, and he did not had a single drop of water for 22 days. So that was the case. But ultimately he came out of it. And then we found a 9/10 match donor. So in the first picture, my husband is having the stem cells donated by that Italian donor, which was then transfused. And it's been now 15 years. My husband now owns Java, is continuing with his biking obsession. And he's doing digital marketing for earning bread and butter for our family. Apart from that, I mean, so this is our own case study. So yes, I mean, this is my side of the psychological pressures or whatever. Like I had a great support from my husband's friends and my friends. I was not sharing the truth about his disease or about his transplant process with my family, because if I would share, then they will be also tensed. So I did not want to suffer all of them. I would tell them that, okay, this is this, this is this. Even I used to hide facts from my husband. I would, my husband would, dig into everything. So I used to request the sisters and doctors, please don't share this fact with my husband. You give any answer, but you don't share this fact with my husband, because I wanted him to be motivated all the time. And so, yes, I mean, but whenever I used to feel like, talking to someone, I used to talk to the friends. So that is all. And if you want to know about the patient's mental state, I would share a link with Sir, wherein my husband has given an interview in NDTV about his mental state when he was diagnosed and when he was undergoing transplant and all, where he has described his journey from Hb negative to O positive very nicely. So this is all from my side for today. And if you want to know anything else, you can ask me.
First of all, thank you so much, ma'am. I know that God is always with you. That's why you overcome from this. This is really blessings, ma'am. Blessings from students. Yeah.
That's right. I'm really proud of my students.
Yes, ma'am. I don't know what to say and what to share. Yes, ma'am. Being an educationalist, reading something in a book is different from experiencing it from
Right.
stories like you, from people like you. And sometimes students will forget why they are studying these things. They don't know how they are going to change the society, how they are going to save the lives of the patients. And these sessions are very important, ma'am. And I'm really happy that you are sparing your valuable time with us to share all these things. And definitely, even one person motivating is sufficient. That that will be a blessings for us. And I'm really sure that this will be impact on many young generations, and they will understand the significance of the healthcare, especially how we are dealing with patients with love and care. And as you said, I was surprised that mental support plays a vital role. And as you said, case 3 or case 2, that I was surprised. Yes, mental support is very important, not only to the patient but also to the parents. They should be mentally stabilized. They should be, yeah, ma'am. This is very interesting.
Yeah.
Any thoughts, students? Anyone want to join?
Yes, to add on what Sir said, that sometimes, ma'am, you said you used to hide some information to your husband. Some people, maybe they face psychological problems during this situation, maybe because of knowing too much. So if they know that they have hope, maybe the hope you were giving him, like the doctor not to tell him too intense news. So he was having hope that is good. Maybe even the situation was worse, but that hope is the thing which kept him going. So congratulations to you too, because there are very few people who can do that.
Thank you so much. Thank you, Faith. So it was pleasure interacting with you all. And I hope all of you will take a pledge to as a blood stem cell donor. And also, like, whenever you are in field, you will be like meeting such people. I mean, I would not say patients, because I hate using that word. I call them as fighters. So I have seen, not only my husband, I have seen so many people. So yes, I mean, you will come across such fighters, and I hope you will be able to support them. I mean, even if they get a little ray of hope, they are so happy. So thank you so much. And thank you, sir, for giving me the opportunity to interact with the students. And
thank you
looking
so
forward
much.
to see you all.
Okay, ma'am. Thank you so much, ma'am. Even I want to see you in campus in person. We are eagerly waiting for you. Thank you so much, ma'am.
I will.
And sorry, and yeah, ma'am. God bless you. God will be always with you, your family. Yes.
Thank you.
Ma'am.
Yes.
Thank
Yes,
you.
students. Okay. See you, ma'am. See you. Yeah. Yes.